Hi, everybody. This is Dr. Kurt Woeller. Welcome to the podcast. So today we're going to be talking about Lyme disease. We'll also be talking about co-infections. Dr. Nicola Ducharme is joining us for this conversation. She is a specialist in Lyme disease now for many years. Dr. Nicola, as she likes to be referred to, her and I go back many years as far as some of our work that we've done in the past. So I'm looking forward to this conversation. So, Nicola, welcome to the program.
Hi, thank you so much for having me.
So, give the audience just a brief overview of your education, your training, and let's get into this topic of Lyme disease, how you got involved, and just sort of the complexities of it. We'll kind of break down, for what individuals need to know, some things to watch out for. So, yeah, a lot to talk about.
Yeah, it's definitely a wide and complex topic. So just a little bit of background on me. I grew up in Australia. I moved to the United States to do my doctorate in naturopathic medicine. And so I went to Bastyr University and completed that in 2003 and then moved down to San Diego shortly after that. So I've been in Southern California all that time. And then, yeah, had the opportunity to start working actually with you. We do go 20 years back at biohealth centers and then at Still Point in your practice. And that was amazing. Had a great couple of years working with you and learned a ton.
20 years.
Um,
Has that been that long?
it's
Gosh,
yeah, it
it's
has.
crazy.
So that was amazing. And so I started learning a lot from you about the autism world, and but then I sort of started seeing some of the parents of the kids that we were working with. And these moms were like in their 30s now. They're like, everything hurts, and I've just got headaches, and I'm tired. And I thought it was just new mom stuff, and then I thought it was mom of a special needs child stuff. But they're like, but this is kind of getting ridiculous. So I did a functional medicine workup, looked at adrenals and thyroid and heavy metals and all the things, and I would start testing for Lyme and was kind of blown away how frequently I was seeing it come back positive. And so it just kind of went from there. I feel like at that point there was a bit of a fork in the road. And I felt that there were more doctors in the autism space, very few, and still are to this day, very few Lyme specialists in Southern California and San Diego, where I am. And so I just kind of went in that direction. And now that's primarily all I see is Lyme disease.
So, by the way, with the lack of practitioners in the Lyme world, do you think that has to do with still this perception that Lyme is isolated somehow to the northeastern part of the United States, that it's not distributed across the United States or North America, that it's really not a problem here? Or is it more than that, that it's so complex and so difficult to sort of wrap your head around, from a medical standpoint?
I think it's those two things. And very importantly, it's that the Infectious Disease Society of America still does not recognize chronic Lyme. So their platform is that acute Lyme exists. All Lyme is treatable with 14, 21 days of antibiotics. And anything beyond that is what they call post-Lyme syndrome, which if you read their guidelines, pretty much implies it's all in your head. So, and this is why Lyme is so politicized, because you've got the Infectious Disease Society denying the existence of chronic Lyme and setting standards of care as short courses of antibiotics. And so any dialogue, any treatment, any, protocols outside of that is kind of outside of the realm of what allopathic doctors are learning as they go through their studies and what's reinforced to them. So it is reinforced in the medical community that there is no such thing as chronic Lyme. And that's why so many people go undiagnosed. And that's why so many people have trouble finding care, especially through their specialists and through their insurance model. They go to psychiatrists, they go to neurologists, they go to rheumatologists. No one's talking about chronic Lyme.
Which never made sense to me. It still doesn't, that they can acknowledge that Lyme can be an acute infection and therefore needs treatment. So you need to give antibiotics for it. That would be the standard of care for acute Lyme. And by the way, tell me if I'm wrong on any of this.
Sure.
Okay, so yes, it's an acute infection. Standard of care in medicine is antibiotics, right? So that would be
Right.
well
Yes.
established.
Yep.
However, if it's not treated, then it just becomes all in your head. And I'm like, well, whatever happened to the infection, right? Because you're going to
Right.
have people who don't get treated,
Yeah.
And how is it that it doesn't become a chronic infection or a chronic problem? Does it just lie dormant and then is
Like,
benign? Well, if
does it
that's
just
the
magically go
case,
away?
this is just then in that case, then why treat it at all? So
Yeah.
that whole thing just has never made sense. But there's a lot of things in medicine that don't make sense.
Well, and even further than that. So I've had patients who were given maybe 10 days of doxycycline or something like that, and may have taken care of symptoms for a while, but then later on, the more chronic symptoms emerged. So whatever short course of antibiotics they got was not effective. And I've also had patients who, and we'll talk more about testing, but who tested positive for Lyme through standard LabCorp Quest type tests, and whose doctors told them that it was a false positive and you don't have Lyme. And so it's like, even
Yeah.
if they test positive, it's being denied. It's crazy.
So I have a question, and then we'll get into what Lyme is and how it presents.
Mm-hmm.
But on this topic, since we've been talking about this, why do you think this is the case? Why do you think this is happening within the Infectious Disease Society? Why have they taken this stance?
I wish I knew the answer to that. And I actually genuinely don't. I mean, I there's different theories. Some of them sort of more conspiracy theories about, Lyme being used as bioweapons. That's a topic I haven't really researched very deeply. Um, but it is a dogged stance, and I don't understand why it is, because if it was coming from insurance companies, you would think that the outlay for an insurance company over 15, 20 years of someone being unwell would exceed the cost of a reasonable treatment if more research was done to find more reasonable and effective treatment protocols. You'd think from Big Pharma's standpoint, they could get to work finding a cure for Lyme, kind of like when HIV came out, and that was sort of a new, massively growing, accelerating thing. I mean, there was so much like celebrity kind of publicity. There was massive research dollars. There was, big pharma got involved. Like, and today people are living with HIV on very effective medication protocols. It's they kind of, I'm not saying they won necessarily, but they came a long way. They made a lot of progress. And so I don't understand why Lyme is looked at and is still so politicized, when you think that, the big insurance companies, big pharma, all of that could benefit from getting effective treatment out there.
Yeah, yeah, yeah. I don't know. We could talk for hours about that particular topic. I mean, I think from a standpoint, if you think about vaccines for Lyme, they've never been successful, and one of the reasons is that these are intracellular bacteria and pathogens that are very difficult to make a vaccine for.
Mm-hmm.
So, and then from a treatment standpoint, obviously in a chronic state, they're very difficult. So, I don't know, maybe they've just focused on things that they perceive to be a little bit easier or more direct where they can sell their medications. Let's talk about Lyme. So,
Yeah.
what is Lyme disease? How does it typically present clinically?
Yeah. So, how you define Lyme, there's a couple of different ways to define it. Like, textbook definition of Lyme disease is infection with the bacteria Borrelia burgdorferi. Okay. So, that's Borrelia burgdorferi is officially Lyme disease. When we sort of talk in the world of like somebody has chronic Lyme, we're sort of using a bigger umbrella term for not only Borrelia burgdorferi, but other kinds of Borrelia. There are other strains of Borrelia that can be problematic. And some of those fall under the category of tick-borne relapsing fever. But we can also term that borreliosis, right? Just infection with Borrelia, whatever the type. And then there are the major co-infections. So the two biggie co-infections that I look for are Babesia and Bartonella. So I tell my patients it's the three B's: Borrelia, Babesia, Bartonella are the three big things that I'm paying attention to. And then there are other co-infections like Ehrlichia, Anaplasma, Rickettsia, that I find are less common and less distinct in their treatment protocols. Like typically whatever we're using for Borrelia kind of gives pretty good coverage for those. So the Babesia and the Bartonella are the two biggies that stand out as the major co-infections.
So, with Ehrlichia and Rickettsia, so the treatments that usually go after Borrelia will have a positive effect against those two other pathogens. Is that
Correct.
correct? But
Correct.
not so much Babesia and Bartonella. So those tend to
Correct.
get treated a little bit, maybe more separately. So why are Bartonella and Babesia more commonly found than Ehrlichia and Rickettsia along with Lyme? Is it a regional thing
It's
from
not
a,
necessarily regional. I don't think anything in the Lyme world is regional anymore. I mean, I'm seeing people in the US get test positive for US strains or European strains. There's a type of Babesia called Babesia duncani. It used to be known as WA1, WA1, that was considered more of a, a West Coast strain. But with the movement of people and birds and migration of, it just doesn't hold up anymore. Like you just,
yeah,
these things cross borders. And so it's not so much a regional thing.
okay. So I want to come back to Babesia Bartonella and how they present. So the typical, what would somebody suspect from a symptom standpoint? If like
Mhm.
maybe they never saw a tick bite, but they're
Right.
now exhibiting different types of symptoms. What would those typically be? What should raise, their concern that, hey, maybe they need to get tested for this?
So I always say that, if you have this flurry of symptoms that affects multiple systems in the body that cannot be explained, like most people, by the time they come to me, they've seen a neurologist, a rheumatologist, they've had all the workups for all the sort of better known diagnoses and don't necessarily check the boxes for those. So, so nothing really. So the neurologist says there's nothing really wrong with your nervous system. The rheumatologist says I can't really find anything. You don't have autoimmune. Um, but the person's like, well, hang on, but why do my joints hurt? And why am I so fatigued? And why endocrinologist is like, oh, you're nothing wrong with your thyroid. And, so Lyme typically, and again, when I say Lyme disease now, I mean like the big umbrella term for Lyme and co-infections. Um, it's when everything, all the different systems are affected, or many different systems are affected. There's many symptoms. Symptoms can come and go. They can appear for a few months, disappear for a few months, disappear for a few days, come back. I've got one patient whose symptoms appear in the fall, and he shows up in my office in the fall, and we treat him for a month or 6 weeks, and then he's fine the rest of the year. Um, Lyme, migratory joint pain is a very typical facet of Lyme, like borreliosis. So when I think about the sort of the Lyme, the Borrelia part, so typical there would be, fatigue, joint pain, headaches. A lot of the cognitive stuff, the brain fog, what people call Lyme brain, I do recognize as Borrelia, Borrelia itself. The joint pain tends to be migratory. There can be numbness and tingling in arms, legs, face. There can be an element of mood, like they call it Lyme rage, but I see mood stuff relating more to different co-infections.
Okay.
Um, so then Bartonella has a couple of hallmark symptoms. Pain in the soles of the feet is a hallmark Bartonella symptom. People say it feels like I'm walking on glass when I get up in the morning. Or people say, oh, I've had plantar fasciitis, but it doesn't really make sense. Um, Bartonella does a lot of neurological stuff. So my Bartonella people sort of, say from the head down, they can live with it, or from the neck down, they can live with it, and from the neck up, they're a hot mess. A lot of severe anxiety, bordering on panic attacks, OCD kinds of behaviors,
Hmm.
intrusive thoughts. So Bartonella really does affect the central nervous system greatly. A lot of people have like seizure-like activity, migraines, things like that. Bartonella tends to do less of the body pain, joint pain. It can, but it tends to be less of that.
Okay.
And Bartonella is also a bacteria. Now, Babesia is a protozoa, meaning it's a parasite that lives in the red blood cells. It's not an intestinal parasite. It's a parasite that lives in the red blood cells, and it can destroy the red blood cells. So we see a lot of anemia. We see a lot of low iron, a lot of fatigue, muscle weakness. But Babesia also has some hallmark symptoms. So hot flashes, night sweats, temperature regulation problems, shortness of breath, or what we call air hunger. And then Babesia loves the head and neck. So head pressure, dizziness, blurry vision, ringing in the ears, like stiff, crackly neck.
Now,
They can all be Babesia
is
symptoms.
that thought to be the hemolytic component of Babesia, taking out the
Yes.
red blood cells and then causing
Mhm.
whatever vascular inflammation. So
Hmm.
Babesia doesn't get into other cells. It primarily hits the red blood cells.
Correct.
Okay. So that's a great breakdown. So, and again, when people open a book, or they go online to look, so you're going to get these things sort of broken down into individual categories. But that's the way I always thought of Lyme,
Hmm.
the migratory joint pain, maybe fluctuating fever at time, fatigue, for example. The Bartonella, I think that's an interesting one from really hits the central nervous system. So where it really can contribute to mental, emotional, mental health conditions. Um, in advanced Bartonella, would you expect things to move towards a neurodegenerative type of condition? I mean, would it be something that might contribute to the development of dementia or Parkinson's or some other type of neurodegenerative disorder?
Yeah, it certainly could. And also, the Lyme spirochetes have been found. There was a study that looked in the brains of people with Alzheimer's, and there were Lyme spirochetes found there. So I think we can tie that into Lyme as well.
So I didn't, maybe I kind of knew that at one time about Babesia. I didn't think of it because when I mentioned we first started, I talked about these being intracellular pathogens. And I think I said bacteria, but I forgot that Babesia was more of a protozoa, so it doesn't really fall in
Mhm.
that same, but it's still an intracellular within the red blood cell. So very
And
interesting about the
hence
heme.
the treatment protocols are quite distinct, right? Because it's not bacteria. So the antibiotics and whatever aren't going to necessarily hit Babesia.
Right, right. And we can clearly see that now. So you can see why things are sort of separated out to some degree from and you know more about this from a treatment standpoint.
Well, and one thing too, just jumping back to the acute Lyme, and then I just want to make one point while I think of it. So you can see now that 10 days of doxy is not really going to clear Babesia, or doxy has some activity against Bartonella, but it's not specific for that. So this is why it's so important, if people have a tick bite, if possible, keep the tick and send it off to the lab for testing, because the lab will identify which infections, which pathogens the tick is carrying.
So, and yeah, that's really important. What's the lab typically that people would send that towards?
Well, IGeneX does that. I tend to send to the Pennsylvania tick testing lab.
Okay. Yeah, I've
Um,
seen a few.
yeah,
Um,
there are a few.
so I have a question. Was there Have things changed over the years where now the Babesia, Bartonella, and Lyme are now intermixing biologically to where they're so commonly presented together? Is that different now than maybe it was 10, 20, 25 years ago? I don't know if you know, I went to medical school in Maine.
Huh?
And so I graduated. I've been in practice 26 years, something like that. And I remember there was Lyme, right? Because Lyme, Connecticut wasn't very far.
Mm-hmm.
I just, I don't remember if there just wasn't that much then or it wasn't discussed or I was so wrapped up in medical school, I didn't know anything else. But I still have friends who are in Maine and it's just like everybody's exposed. I mean, it's a hotbed for this. So what percentage of individuals that you're seeing now are purely just Borrelia without the Bartonella babesia, or is it such a high percentage now that it's just a mixture of all three?
It's a mixture. I mean, and I remember Dr. Horowitz making a comment, and he probably made this comment 10 years ago. And his comment was 20 years ago, and of course, he's upstate New York. Um, 20 years ago, he said that he saw more people just with Lyme itself, with Borrelia. He said these days it's much more of a mix of the different co-infections, and I have the same experience. Like very, very rarely do I have someone that I don't suspect they have co-infections, and it seems to really just be purely Borrelia.
So really almost going in, Nicola, it's you're almost hedging your bets that they have a mixture and not just, and this is why people need comprehensive testing, which we'll talk about. So do children tend to present differently? I keep saying Lyme, but let's understand that that's a larger umbrella
Yes.
term.
Yeah.
But do children tend to present differently than adults, for example, from a classic
Yeah.
standpoint?
I do see children presenting somewhat differently. They present less with the classic joint pain and headaches and things like that. It tends to be more neurological in them. And so, you have this interesting thing too. Like some of my patients have been diagnosed on the autism spectrum. But they also have tick-borne infections. So it's sort of then a question of like what's playing what role. And I'm not for a minute implying that all autism is tick-borne infections, but there is a subset of that population that are also infected. And we know that tick-borne infections affect the nervous system, the neurological system. So there's some role there. Certainly in PANS, some of these PANDAS kids, tick-borne infections play a huge role.
Okay. And I had done a very interesting interview on PANS pandas with a previous practitioner on one of the other episodes. And one of the things that she had laid out, which I had never thought of, and it makes a lot of sense, is that, what we're talking about PANS pandas, it's really like PANS is an umbrella term now. It's sort of the
Mm-hmm.
umbrella of
Mm-hmm.
everything, whereas
Yeah,
pandas is a subcategory of PANS. So you realize now you could take Lyme or Bartonella or Babesia or that complex and add that as its own separate subcategory within this
right,
larger of pan scenario.
right.
So I want to talk about testing. We'll talk about some treatment, but since we've been talking about Babesia and the Bartonella, we talked about sort of the classic presentation of how some of those things manifest. Um, are there some atypical things that you, as a specialist in this area, somebody who maybe doesn't have the migratory joint pain, somebody doesn't necessarily have the neurological component or the hemolytic issues. Are there other ways that these organisms can affect people that would raise your concern that their health condition is linked to these infections? That's
Yeah, I
kind of a
mean,
difficult question, I realize.
no, that's okay. I mean, I think it's important to know that Lyme disease, again, the big Lyme now, is called the great imitator. So a lot of people have been diagnosed with other things along the way, like chronic fatigue syndrome and fibromyalgia. They're very common diagnoses, but they don't tell you anything about why it's happening. But some people have been diagnosed with MS, for example, because MS, they'll do an MRI, they'll see white lesions on the brain, they'll look at neurological function, and they'll diagnose with MS. Well, Lyme can cause white lesions on the brain. Like I worked with MS patients whose condition has significantly improved with adequate Lyme treatment. Um, some people have terrible, terrible hormone imbalance. Um, and female reproductive hormones go up the creek. Some people present with like more autoimmune markers, Hashimoto's thyroiditis, or they have a positive ANA, a positive autoimmune marker that Lyme can actually trigger. So there's really a very wide range of presentations. Like I have a patient on that I'm treating right now who has no fatigue, no body pain, interestingly, no cognitive challenges, clear as a bell mentally, but has wicked like dizziness and off balance and it's like vertigo stuff um and heart racing in the middle of the night. And so it can present really, really differently in different people. So it's not unusual. Like if somebody doesn't have any joint pain, it doesn't mean they don't have chronic Lyme. It can just manifest differently. Or to what we've been talking about, the co-infection piece is so crucial to look at because people can be more dominant in one co-infection. And so they may be having more problems with Babesia and Lyme is kind of secondary for them.
So let's talk about testing.
Yeah.
So it's a minefield essentially of all kinds of
Yes.
markers and from antibodies to PCR to different types of things out there. So there's a lot into that. So I know this is an area that you focus a lot on. So let's talk about some of the pros and cons of lab testing for, again, Lyme, Babesia, Bartonella. Would it be appropriate to call that Lyme complex? Is that term used?
Or just tick-borne infections is the
Tick-borne
probably the
infections.
term that covers all of it.
Gotcha. So let's
Mm-hmm.
talk about lab testing. What do you tend to use? How do you start? How do you
Yep.
assess? And then I have some questions for you on that.
Of course, yeah. So the first thing I want to point out is that like standard testing through, big commercial labs is really inadequate. Like the testing that is done, the basic ELISA test, um, that was a surveillance marker. That was never meant to be used as a diagnostic lab, and then it got somehow adopted that way, and it's just not sensitive enough. Now, many times, the ELISA test is reflexed to the Western blot, meaning the lab won't run the Western blot if the ELISA is negative. So if the ELISA is negative, they'll stop there and say you don't have Lyme. If the ELISA is positive, they will go on and do the Western blot. But again, the number of bands they recognize, it's just very, very limited. So if you've been tested for Lyme through, just a general sort of basic blood work at a LabCorp request or whatever those sort of big standard labs are, and it was negative, then I would encourage you to not stop there. Like look further. So that's the first thing. The lab I've used for 20 years is IGeneX. They're a specialty Lyme lab. They're located in Northern California, but you can send samples from anywhere in the world. And that they are my go-to. They have, in my opinion, the most sophisticated testing. There is no Lyme test that's 100% sensitive. So, Lyme is a clinical diagnosis backed up with lab work, lab results. And so we look at the lab results, we look at the patient and what their history is and how they're presenting, and we sort of marry those two sets of information.
Can I interject something real quick?
Yeah,
Nicola,
sure.
real quick. I love the way you describe that. It's a clinical diagnosis. You take the clinical presentation of the individual plus the lab testing, merge the two together to see how well they connect. And that's a major point of emphasis that I've made with many other lab tests, that I do. And as you're familiar with, like the organic acid test, we're not treating the marker. You're working with the individual where those markers are coming from. And so it's critical in any lab, for the most part, to be able to merge the two. And that's where you really get into the subtle aspects of clinical medicine, which brings another question I want to ask you. I'm going to let you finish what you were going to mention, though, is you can have tests that are oversensitive. And now all of a sudden, somebody's showing up with markers that may not necessarily be representative of a true problem. So we'll come back to that, but finish up. So I know the ELISA testing, the Western blot, for example, and so continue on. I apologize for interrupting.
IGeneX, no, you're fine. IGeneX has developed immunoblots, which is just the next generation, a little bit more sophisticated version of the Western blot, and now offers immunoblots for Borrelia, tick-borne relapsing fever, or Borrelia burgdorferi, I should say, tick-borne relapsing fever, Babesia and Bartonella. So they have immunoblot testing for that. This is still testing that measures antibody responses. So we still have to keep in mind that Lyme, the big Lyme, tick-borne infections can be immune suppressive. And so we're measuring an immune response to, a pathogen that suppresses immune response, right? So it's a little bit inherently flawed. However, I still find IGeneX, their immunoblots, to be excellent, and I really trust their testing. They also offer a FISH test for Babesia and Bartonella. So that is a direct test. That's actually staining it, looking under the microscope, seeing if it's glowing in the dark. And I like those tests as well. Historically, I have not found the PCR testing to be sensitive enough to warrant the extra expense, because this is out-of-pocket testing for everyone other than Medicare.
That's interesting.
So I was always finding when I ran both, I was getting my information from the antibody testing more so than the PCR. Because, PCR is looking for the DNA of the bacteria in the bloodstream. So, and, bearing in mind that these bacteria spiral their way up into the tissues, they're not just hanging out in the bloodstream. So they're harder to find, especially in people who've been sick for a long time. Now IGeneX offers a culture enhanced PCR. It's a newer panel. I have not really had enough experience with it yet to know if it's a winner, but it's designed to make the PCR test more sensitive. And so again, they are always looking to improve their testing methodology. I like the immunoblots so much that I just continue to work with those.
With the PCR, one of the complicating things too is the spin cycle levels that lab may use. So if it's set too high, well, you're going to pick up on all kinds of DNA fragments of things. So, nucleic acids, whatever. So it's like anything. If you set your parameters on the spin cycles too high, you can be oversensitive. If you lower your thresholds too low, well, that could be oversensitive depending on what medium you're using, antibody testing, for example. The immunology of this is complex, probably beyond what we have time for to get into here. But it sounds like, you're using the immunological antibody assessment tools in their different levels of complexity to get the bulk of information. And then maybe the fish analysis, which we actually look under a microscope to say, yep, it's there, as
Mhm.
maybe additional confirmation, but the PCR, not so much. Is that correct?
Correct. That is
Okay.
correct. Yeah, and then I do want to just speak to this, and there are a couple of other labs that offer Lyme testing. I stick with IGeneX because I trust them, and I've used them for years. And I would also say that they're, in my view, considered gold standard in the industry. There is some great testing out of Germany. Armin Labs and such offer some great testing, but yeah. So IGeneX is sort of the main player here, in my opinion. I do want to just mention this, Kurt, because I think it's kind of cool, like of what we were talking about of marrying lab information with clinical presentation. So I developed this process called a co-infection provocation, and I use it in many, 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 many of my patients. And so how that looks is I start out by supporting detoxification, because as soon as we start killing off pathogens, they release toxins and it can make the person feel worse before better. We call that a Herxheimer reaction, or a Herx. And so I try to set them up well with detox support. And then after that, the provocation itself is a 3-step process. And I separate these out by at least a week. So the first week, I introduce a herb that targets more the Borrelia itself. The second week, I add on a herb that targets more Babesia. And the third week, I add on a herb that goes more after Bartonella. And I have people take notes about how they feel along the way. And it's been extraordinarily helpful in discerning those co-infections, and gives me one more layer of information, so that, if I meet with someone new, I order lab testing, it's going to take realistically a month before we have the results. I have them do this process. And then by the end of that, I say, okay, tell me how you felt, step 1, 2, and 3. And people will say things like, oh yeah, not much with the first one, but oh, the second one, like my night sweats flared up, and some people the first one, my joint pain improved and I felt a lot better. And then the second one, I didn't really notice anything. And then the third one, I felt my anxiety, pick up. So that process has been so helpful, because then at the end of that month, I'm like, okay, let's see what the lab shows. Let's see what that provocation shows. And then again, marry those two pieces of data. And that gives me a lot more clarity about which co-infections are present for them, which co-infections may be dominant for them, and which co-infections may be contributing to which symptoms.
That's brilliant, Nicola. I love that. And so that's great. In fact, I can see you pulling that from your naturopathic training.
Yeah, yeah.
Just the using and understanding the mechanisms. That's very cool. Does that work as well? Maybe to do a challenge like that prior to testing? Does that improve detection through
So
lab testing?
I have talked to, sort of unclear, but probably not. I have talked to Dr. Shah, who's the medical director of IGeneX, about provoking. Like, some people say if you provoke with 21 days of doxy, you're more likely to get a response because your immune system's a bit more kicked up. Her opinion was that it didn't really play out that way. So I don't tend to do it before testing. I tend to do it while we're testing.
Okay.
They get drawn for the lab first and then spend the next 3 to 4 weeks doing the provocation. And, I dose dependent. I have my standard dosing. And then if someone's really, really sensitive, then we go, baby doses. And some people say, oh, I don't want to wait a month to start treatment. I'm like, no, this is treatment. This is treatment starting. But I always start people on herbs, even if we're heading towards antibiotics, just because firstly, I get to see like how much Herxheimer reactions they have. Like, some people Herx more than others. Without the crossover of like, well, was it a side effect of the medication, or was it truly a Herx? And it's just a more gentle, graduated way to start. So I always start people on herbs before medications anyway.
So much of what we do in this functional integrative medicine space is kind of what I've called treatment tests, right?
Yep.
There's not always a lab for everything, but you can do what you're doing. And in essence, it's a test. Because I've done this
Correct.
with some of the autistic kids over the years, where you're like, I'm really suspicious of candida. The labs are, yeah. maybe a bit
Mhm.
inconclusive, but boy, the behavior certainly fits. Put them on nystatin for a couple weeks and let's see. And these things are safe to do, but they could be very revealing. Before we move on, I'm curious in this scenario of you draw the blood, you're waiting for the lab, you do the botanical stepwise progression. What percentage, just approximately, when they come back, that they match up pretty well with what they showed on how they felt and what their labs show?
75%.
Okay.
I mean, it's pretty good. If anything, there may be like one of the co-infections that didn't show up on the lab that we're like, oh no, we know that one's there. I mean, like I said, there's no Lyme testing that's 100% sensitive and 100% accurate. But I mean, it does match up a lot.
Yeah.
But that's where like I'm going to treat the person. So even if the lab test doesn't pick that co-infection up, if we have strong suspicion, I'm going to treat them for it.
So in this, in that discussion of what you just laid out, that to me, at least in part, would, because of course you're going to the individual, but then that might help isolate out, well, which one do I go after first?
Oh,
Right?
100%.
So now
100%.
you can get a little bit more nuanced with your interventions because obviously from the treatments of Borrelia, Bartonella, Babesia, they're slightly different or maybe significantly different. So I think that sort of gets into what do you do with a patient that has multiple infections? How do you prioritize which one to go after? I'm assuming your stepwise progression of these botanicals is part of that.
100%. Yeah. I mean, it really dictates how we design treatment moving forward because I tend to go after the dominant co-infection, whatever one I think is causing more issues. Um, there are some practitioners that just have a hard and fast rule of like, first we treat Lyme and then we go after Babesia and then we go after Bartonella third. For me, I don't have any rules about it. It's typically like, which one do we think is playing the biggest role here? And sometimes, say for example, I've got someone with tons of Babesia symptoms and they're having night sweats and shortness of breath and all those kinds of things. However, they're also having like panic attacks and like the really severe anxiety pieces, or maybe even suicidal ideation, or the things that seem to be more Bartonella driven for them. Even though they may have fewer of those symptoms, if they're more life altering and or verging on life threatening, then we're going to start there. So if someone's like, this is what really ruins my life the most, then we're going to start there and try and bring them some relief.
So, Nicola, that is another thing that I've often commented, and we may have talked about this in the past too, is people often say, well, what's the protocol for Lyme? What's the
Yeah.
protocol for Bartonella?
Right.
And what you realize is the longer you're in practice working with these complex situations, is that a protocol is a starting place, but it's only as good until the next person it doesn't work on. And
Mm-hmm.
then you have to get back to figuring things out clinically because it's the same thing in autism. It's the same thing in mold and mycotoxins, environmental chemicals, you know, COVID, post-COVID, whatever, right? Very few people meet the exact textbook and the protocol that's laid out. Works for some, but often not for everybody. And by the way, what you just described is something that I have commented about too. You know, yeah, the tests show Lyme or Borrelia is the major issue. And yeah, the initial trial run of those botanicals really kind of shows this is the big one. But then all of a sudden, the mental, emotional, suicidal ideation thing comes up. You have to shift course. You
Mm-hmm.
have to get that person out of that crisis situation. I've seen this with some of the autistic kids I treat, where they may have candida, they might have mold, they might have gluten sensitivity, or might have heavy metals, but they're self-injurious and they're
Mm-hmm.
aggressive.
Mm-hmm.
And that's a problem because that's not a long-term way to live, and they're a danger to themselves and others. And so you have to do things to sort of try to get rid of that. That might be using an antibiotic for a Clostridia bacteria that's driving that problem. So this gets into the nuances of just clinical practice and experience. The Let's get into other complicating factors, right? Because people don't live in a bubble.
Mm-hmm.
So Lyme, tick-borne illness people don't live in a bubble. They're exposed to food, they're exposed to environmental factors, mold, mycotoxins, etc. Let's talk about that. What are some other common complicating factors that tend to exacerbate these tick-borne problems?
I would say mycotoxins are number one. Mold exposure. Um, I had no idea 10 years ago that this was such a big deal. Um, and then about 5 years ago, I started paying attention to it. And now I try and test all my Lyme patients for mycotoxins because it's such a huge complicating factor. Um, so that's a big one. And sometimes we have to put Lyme treatment on hold. If the mold is such a big deal, we need to deal with that first. And of course, that raises all the questions of having the house evaluated. And if there's mold, if they're living in mold, then nothing's going to get better. You know, even we can treat Lyme till the cows come home. If someone's living in mold and has high mycotoxins, they just won't get all the way well. They can make progress, but there's going to be a bump in the road somewhere. So that's a really big one. Heavy metals, heavy levels of toxic metals, I would say is another complicating factor. Biofilm, of course, we have to consider. Lyme creates biofilm, so we have to be weaving that into our treatment protocols. That's not so much sort of a complicating factor as just a base to cover. The other thing that I see a lot of is this sort of limbic system dysfunction, you know, where people have got stuck, you know, part of their central nervous system is stuck in like fight or flight, and then, you know, gets into these sort of these negative kind of neural pathways. And so we need to look also at finding ways to calm the nervous system, like, you know, and so, you know, programs like Annie Hopper's DNRS, the Gupta program, Primal Trust, things like that are really important. I also work with my folks on mastering mindset. So I developed a program called the Transformational Healing Academy Mastering Mindset Program. And it was based on training I did in hypnotherapy and NLP. And so it's a whole program that helps people with chronic illness, like work on their mindset. I teach them tools and practices that they can do every day to help program their subconscious mind for healing and get out of that cycle of despair and hopelessness. Because that's another thing that we see a lot. You know, some people have been sick 15, 20 years. Like this is bad. They've lost a lot of their life, you know, being mostly housebound or even bedbound. And so working on that mindset piece and also the limbic system piece is so crucial. And I do find that my folks that get on board with that, it helps them to recover. It does, because it keeps them in that positive headspace moving forward and helps them to get into parasympathetic response in their nervous system, rather than always being in the sympathetic fight or flight, where healing can't happen there. Right?
Yeah,
Like,
those programs and the things that you developed, you know, are fundamental for these types of chronic health problems for sure. I mean, the nervous system just setting up, being in that sympathetic fight or flight response, right? You're saying the healing factors are really difficult to access. You almost get into that cell danger response situation too, where just at a real biological level, things are hyper reactive. So whether it's mold, whether it's these co-infections, you know, physical injuries, whatever, that the limbic system, the stress reducing responses are absolutely critical. And we know too, if you think about it, Nicola, you and I go way back into the early days of biohealth, right? I mean, that's where I first started learning some of the fundamental concepts of functional medicine was from Dr. Timmons
yes,
talking about the chronic stress response. In fact, I still use that chronic stress response slide that we had from 20 years
right?
ago,
Yes,
you know,
yes.
and just the mental emotional toll has an impact on the immune system,
Oh,
triggers
absolutely.
inflammation, and keeps
Yep.
people locked. So it's interesting you mentioned mycotoxins, right? Because I feel the same way. Metals, environmental chemicals, I mean, those are all important. It's not to say that that may not be the main thing for a particular person. But generally, some of the sickest people I've seen, most highly reactive people I've seen, mental, emotionally, neurologically, immunologically, tend to have mold mycotoxins somewhere in the picture. And I think they're just because they're such highly immunogenic type of compounds. The biggest concern, well, not the biggest, but one of the concerns I would think for these tick-borne illnesses is that these things themselves are highly evolved in how to evade the immune system. It's a reason that they're suppressing the immune system is to create more of a biological niche for its ability to survive.
Mhm.
The problem with mycotoxins, many of them, is they're also immune suppressive. And so they take out both innate and adaptive immune components, which are critical. You take out components of the innate immune system, you can't combat these chronic infections. The same with some of the adaptive mechanisms. I'm, I don't want to say I'm assuming, but I kind of am. I'm assuming you're seeing the same type of thing in that probably people who have the mycotoxins just can't get over some of their tick-borne illnesses, infections.
Correct, correct. And then a lot of people who have the mycotoxins are then getting mast cell activation syndrome or MCAS, and they're getting their histamine responses are blowing up. And so we even have to work on calming the histamine response before we can get to treating anything because they're so reactive. So we, have to go a step further on that front before we can even get them into adequate treatment for getting the mycotoxins down and then being able to deal with the tick-borne infections
Yeah.
at the end of it all.
I want to come back to testing that is oversensitive, right? Because you can get locked into this framework that you become hyper reliant on a lab test, and the lab test becomes, the only thing that some practitioners will look at. And what are some things that you've seen? Maybe people have come to you with lab tests where you're like, I'm really kind of questioning whether this is truly accurate or not. Are there certain parameters that you look for? Are there certain markers that may show up that are sort of outside the norm or what's typically recognized in the Lyme world as far as diagnosis of these tick-borne illnesses?
I mean, some labs have higher, benchmarks or higher, stricter parameters for diagnosis than others. And there are a couple of labs out there that I have found sort of have lower parameters. So they're showing up more people who could potentially be diagnosed. Um, and it really comes down to the skill of the clinician at that point to discern, like, okay, is that really what's going on? And to your point, Kurt, sometimes how we also gauge that. So there's what the lab shows, there's the clinical presentation and the history of the patient, and then there's how they respond to treatment. So whether it's through the co-infection provocation or an antibiotic protocol, when you're looking at and then ruling out other things, right, that could mimic. So looking at heavy metals, looking at mycotoxins, looking at some of the other things that have a lot of overlap in terms of symptoms, to see, well, what else could it be? Because usually by the time people evaluate chronic Lyme, they've been worked up for most of the standard stuff, right? Most of the
Right.
sort of recognized in the allopathic world. So looking at it from more of a functional or integrative standpoint, um, are they gluten intolerant? Do they have high levels of mold? Or is their histamine going off the charts? Do they have high oxalates? Like, all the sort of laundry list of other things. And of course, one point I wanted to make before is, the adrenals get tanked in all of this. So, and then a lot of people aren't having healthy cortisol responses. And that can have an implication for immune function and for inflammation in the body. So it's really about, if there's a practitioner that knows enough to test for Lyme, but isn't fully Lyme literate, well, that's great. At least they've recognized that Lyme, they've brought Lyme into the conversation. And then the thing to do would be to refer them on to a Lyme literate specialist, who can really then discern, like, okay, is this really what's going on? Or is it just, maybe somebody had IgG antibodies to one of the pathogens that might be more of a memory cell. It might have just been that there was an exposure, but they're not actually infected. So this is where the sort of clinical discernment comes into play. And I
Yeah.
also have a theory that there's a ton of people out there walking around with Lyme, like some people get sick and some people don't. Some people's immune system just takes care of it. And part of the reason I know that is because I've had many, many, many patients who are like, yeah, well, I guess I had a kind of longer term history of, I had some fatigue or my brain was a little foggy, but I was fine. I was functional in my life. And then something happened, right? And that something could be a car accident, a divorce, a death of a loved one, um, childbirth, postpartum period, any stressor on the body, and then it just, sort of took their immune system out to where it couldn't manage what was going on, and then everything got worse from there. And I've seen that so many times. And I would actually put COVID in that category as well. We're seeing a lot of like activation of Lyme post-COVID. And a lot of my patients have either their symptoms have flared up. I've had a couple of patients who are in remission that seem to be sort of reactivated post-COVID. And so that's included now as one of the stressors that can put, that can tax the immune system to where the body doesn't cope with Lyme as much. And we also believe that some of what people are calling long COVID is actually tick-borne infections that were activated that they may not know that they had.
That's very interesting. Yeah, you had mentioned that before we started the interview. But that could be a whole other interview conversation.
Mm-hmm.
One of the things you mentioned, which I totally agree with, is the testing certainly can be helpful, but in some cases, over testing can be problematic because the more stuff you test for, generally the more stuff you'll find. But whether that stuff is always clinically relevant is not always the case. I can make that comment even about mycotoxin testing. Those are tests of detection of exposure. They don't define an illness. Now, the toxins themselves are toxic, but that not everybody is having a toxic reaction to something that they always test for. So again, it comes back to applying that information to you as the individual and you as a practitioner to the patient you're working with. So let's strip this down. So let's just take sort of that scenario that likely doesn't exist, but just as a in general, right? The person comes to you, they have all the characteristics of Borrelia, for example. I know it's a tick-borne complex, and they don't really have a lot of other food issues. There's no real significant environmental factors. It's purely, they got bit, they never got treated, or maybe they got doxy for 10 days, didn't work. Now they got chronic symptoms. And so they're pretty good to go. In general, the length of time, and I realize everybody's a little bit different, but the length of time of botanical or combination antibiotics or that you might, what would many people be looking at? Is it in a 3-month? Is it a 6-month process for them to start feeling improved or better? Or should people expect in general things to be happening pretty quickly?
Well, treatment is always longer and slower than we want. So I tell people we should have you feeling fairly significantly better in 3 months, but treatment is typically between 1 year and 2 years.
Okay.
And I know that's kind of shocking, but that's the reality of it.
Okay. Fair enough. And obviously then goes without saying that gets more complicated the more stuff you layer in.
Right.
Right.
So it depends on their co-infections. It depends on how sensitive they are, because obviously people who are really, really sensitive, and we have to go very slowly with dosing, it's going to take longer than people that we can just jump right in with antibiotic protocols.
What
And also
is,
other things people are able to do, if they're able to do ozone as an adjunct therapy, if, there's other things now like SOT therapy we mentioned before.
which
So
is
it's a
what? What
question
is
of
that
how
again?
they,
SOT
that's
is what?
supportive oligonucleotide therapy. It's a really clever therapy that basically works to disable the pathogen's ability to replicate. So it doesn't necessarily take the place of doing antimicrobial therapy. So it wouldn't be the first thing I do with a patient when I start working with them. However, it can be very, very useful in disabling the replication of the pathogen. So we're killing off the active ones and it's working behind the scenes, and it works for up to 6 months in the body.
Would you say your approach as a naturopathic physician is primarily botanical targeted nutrient intervention up front for most people with these problems, and then you have selective use of antibiotics as needed, or is it a greater percentage than that? I know it's going to be based on the individual, but
Yep.
sort of how you come into this world.
The majority of my patients do antibiotics at some point.
Okay.
And I use naturopathic support. So I never would do antibiotics by themselves. If somebody was insisting on that, then I'm not the right practitioner for them. most people come to me as a naturopathic doctor understanding that I'm integrative in my approach. So not everyone does antibiotics, not everyone wants to, and not everyone can tolerate them. And so that's obviously the first question. Some people do selective antibiotics. So for example, if Babesia seems to be their big deal, we could do like a single Babesia med and then do herbs, for the other stuff. But I will say I do antibiotics in the majority of my patients with herbal antimicrobials to help and naturopathic support, whether it be through botanicals or, detox helpers like glutathione, and obviously, probiotics and gut support. But yeah, so more of an integrative approach, I would say.
Are you finding the cases of people that you're working with, the typical, tick-borne illness case, 10 years ago, 15 years ago, and today getting more complicated and difficult to treat? And if
I
so, what do you think's going on?
I mean, I would say I think the mycotoxin issue has definitely complicated things a lot. So whether that's getting more prevalent or I'm just getting more aware, because that really wasn't on my radar until about 5 years ago. I think the multiple pathogens with all, those three big Bs being found in most people, like most people have some element of all three. And then, yeah, and I think just, stress levels in the world, I think everything, like the world just it's never quite gone back to normal after COVID, I don't think. That was a significant impact for a lot of people. And the other thing that I wanted to mention earlier and forgot that I'll mention here is just, a lot of people have medical PTSD from everything they've been through in their journey. Not that chronic Lyme wasn't diagnosed, it wasn't recognized. A lot of people today, if they still go to a specialist for a cardiac workup and say they're being treated for Lyme disease, they'll be laughed or yelled out of the office. I mean, some very bizarre things have happened. And so that's an element too, to recognize in people that there can be some real trauma built in just from everything that's happened along the way. And that can complicate things. Like, I really encourage people to work on, if they have trauma in their past, if they have medical PTSD, like working on those things can help their physical healing.
That's a sad state when you have to label something medical PTSD, which
I
is
know.
unfortunately a reality. So, what should people be aware of with regards to these tick-borne issues? Is, you know, geographics. I think that's been pretty well established, right? Lyme is well beyond Lyme, Connecticut. I mean,
For
so
sure.
it's distributed everywhere now, and these other co-infections as well. But let's say our pets a potential exposure source. We could have an entire discussion about spray repellents, what's most effective, and then what are some of the
Mhm.
offset problems that, but in general, people going out, whether it's hiking or things they're putting on to try to repel some of the tick issues. You're in San Diego County. I know you're going to have a different sort of issue than maybe where I am up in Oregon or other places around the country. But, in general, first off, pets, what's some risk factors there with pets?
Well, one of the risk factors with cats is Bartonella, because cats can carry cat scratch fever. And that is one of the strains of Bartonella. So there's that. I mean, dogs can carry ticks, of course. And the other thing that's really frightening is, and there's not really a lot of research on this, but I've seen enough to know that, we think Lyme can be transmitted now by mosquitoes or fleas or lice. I've seen cases where that seemed to make sense. So just being as careful as possible. And I know everyone's different, but for me personally, I do give my dog a monthly flea and tick preventive, so that she's less likely to be walking around with ticks on her. Checking animals for ticks, and just sort of being sensible there. There are also some sprays, some natural like sprays that you can put on an animal, like if you're going hiking, that are, essential oil based, that are pretty safe. So yeah, just trying to be mindful and sensible about it.
Okay. By the way, real quickly before we're done, I remember this is for people, if you're in Southern California, San Diego, Torrey Pines, right? The state
Yeah,
park.
yeah.
So
Uh-huh.
years ago, there was an entry point up by the golf course, and there was a sign actually from the San Diego Public Health Department that said there have been Lyme ticks found in that particular area. And that thing existed for years. I actually had a child once when I was in Southern California who had documented Lyme, at least on lab testing, had some symptoms of it, but it was absolutely denied by the San Diego Public Health Department. And it was shortly after that, I can't say it was that case of mine, but it was probably within about 6 months or so, that sign disappeared,
Yeah, I remember that sign.
And so I'm just curious, you know, most people wouldn't think of Southern California as a hotbed for Lyme. You know, you're drawing people from that area. I'm sure you're working with people all over. But what are you seeing locally, in Southern California that is concerning to you?
Well, I have seen people, I have had patients with acute Lyme that got bitten like in their backyard. So Lyme is here. There have been ticks we have a huge park called Balboa Park. There have been ticks that in that park that were tested positive for Lyme. I will say there's not as much Lyme here as other parts of the country. That's true. Central California has a ton of Lyme. Northern California has a ton of Lyme. However, I don't hike Torrey Pines. Like I'm not going there. What worries me here is that people with Lyme are going to doctors, and doctors are saying, well, there's no Lyme in Southern California. There's no Lyme in Southern California. And I mean, these people might have come from Minnesota, and
Right.
there's this disconnect. They won't accept that Lyme might be there or might be an issue. Even if they've come from Lyme, Connecticut, they'll just be like, oh, you're in Southern California. There's no Lyme in Southern California. And the person might be like, oh, well, I got infected in Connecticut. And they just want to sweep it under the rug. Like they just want to deny it no matter what.
What's
So
happening? What's happening in the naturopathic medical world? So, you think about the two major schools of naturopathic physicians, one in Washington, one in Oregon. Are you within your profession? Is it being discussed more? Is it recognized now? Or is it kind of like the conventional medical world? There's just a certain select individuals that are interested, and for the most part, everyone else either doesn't want to deal with it or doesn't recognize it.
I think the latter. I mean, and I say I think because I'm not really in that sort of, I don't teach at the schools or whatever. So I'm not really plugged into what conversations they're having about it now. Um, I have had a couple of patients that were students at Bastyr that got infected up in Washington. And so, obviously in that kind of situation, that person's going to bring some awareness. But I remember when I went through school, I mean, we were taught that Lyme was an infectious disease. And I think we probably just got standard
Yeah.
education about it. I didn't know anything about it till I was out in practice and started figuring it out. So my sense is that it's not getting sort of tons of attention. But you look at a group like ILADS, the International Lyme and Associated Disease Society, which is like the association for docs or practitioners that treat chronic Lyme. And there are certainly, a growing number of naturopathic doctors in that organization. So I mean, I think there's a subset of people that are interested in it, a lot of them through their own experience. I'm one of the few Lyme docs I know that hasn't had Lyme or doesn't have Lyme, because a lot of people get into it because they need to figure it out for themselves or a family member.
Yeah. And that's, yeah, I've seen that a lot in other kinds of, subspecialties, within healthcare.
Right.
Do you see
Well,
the
it makes
meat?
sense.
Do you see the needle, the needle moving at all in the conventional world? Or, or is it still pretty much the same as it was 20 years ago? Like
I
I think
don't
you
see
just
it
alluded
moving
to
that
that
much.
actually. Yeah.
Yeah, I don't see it changing that much, sadly.
So let's talk about action steps. Some things that people should be aware of, you know, how they contact you, tips or suggestions on, things to consider this as a possibility for them. Um, and making sure perhaps it's don't just take the first doctor's advice, or
Mhm.
comments or input on, oh, there's nothing wrong with you or it doesn't exist, for them to dig a little bit deeper. And then some of your resources. I know you have some books too.
Yeah. So the first thing I'd say is make sure if you want to explore this, make sure you're getting with a Lyme literate doctor. And ILADS does have a physician listing on their website. Even within that, there are some docs are better than others, as the case with everything. I do work with people across the country. There are some limitations across state borders about prescriptive authority, but in terms of testing and naturopathic support and guidance, I can certainly provide that. And try to get IGeneX testing. It really is, in my opinion, the best. It is expensive. I understand it's out of pocket. And it's the best testing. And this is really, really important. So I would sort of start there and just realize that the politics of Lyme is such that you're never going to get, not never, you're very unlikely to get a lot of support in traditional specialties, including infectious disease, maybe especially infectious disease doctors who you would think that you would go to for an infection. But in this case, they're likely to deny the existence of it. So yeah, I have a couple of books. So I have 3 books. One is The Lyme Diet. That was my first one. And then I have The Beginner's Guide to Lyme Disease, which is great for anyone who's sort of brand newly diagnosed or wants to explore. It's, breaks down like, what are the different co-infections? What are the symptoms of the co-infections? What are the treatment protocols? How does diet play in, and which diet does play in? And just kind of gives the whole bit. And then Lyme Brain is more specific to like the neuropsych cognitive elements of Lyme. I also have 2 online programs, Lyme Ed for patients and Lyme Ed for practitioners. So there's a practitioner training version of it as well as a patient version. And then I have my Transformational Healing Academy Mastering Mindset program. And it's found on, you can find it through the Restore Medicine website, not have an E on them. You can contact my office through that website as well.
Terrific. And Nicola, the audio is cutting out there right towards the end, of course, right as we start to wrap up. But all that information you just provided about your links, your courses, your books, I know is on your bio. It will be on your bio page that people can access. So I want to thank you again. It's been a very informative interview for me, and I'm sure people listening. I like the way that you broke down, or I didn't quite understand the Lyme, the Borrelia, Bartonella, Babesia, that triad, if you will, right? That there's a lot of overlap, and those things really need to be almost considered together. That's fantastic information. And like anything, there's obviously complexities with other things that we're exposed to. The last point, and this is something that's very important to me, I know is for you, is for patients out there, keep advocating for yourself, keep educating yourself, keep asking questions, keep digging. There's a lot of hope and help that can be achieved through integrative functional medicine. But people need to be tenacious, and they need to advocate for themselves and keep reaching out for information. So thanks so much for all the work that you have done in this field for many years. It's a pleasure to know you and have worked with you in the past. I lean on your information a lot when I'm encountering this in practice, because like any practitioner, right, there's only so many things you can sort of be a specialist in or very knowledgeable about, and your information is fantastic. So thanks again, and thanks for joining us.
You're so welcome. It's great to be here.